you see, your spine, it's not a long, hollow tube of bone. It's segmented, and it's segmented by 24 individual bones called vertebra. Now, this is why I would agree that your spinal cord is the second most important part of your body because it's heavily protected by the spine. Now, the unique thing about each vertebra is that these bones are movable, right? And they have to be this way so you can bend, twist, and move your body around. But because they are movable, this means that they can get moved out of their proper position. And most commonly, from the injuries throughout our lives, right? We've got the sitting, the bending, the twisting, lifting, falling, the sports, the car crashes, the driving, the bumps, the bruises, the airplane rides, picking up the children, all the things we do from birth, kindergarten, high school. All that stuff can and will cause these vertebra to misalign and shift out of their normal position, which can stretch and pinch and choke off the nerves that control our every function. So it's really important to talk about what happens to the body when these spinal vertebra misalign. Now, all of you should understand this example relatively well. Because if I told you that your best friend, if they dislocated the top bone in their neck, the atlas bone, then what would that mean to you? Now, I'm hoping we can agree that this event would be severe, right? Because it takes a serious injury to dislocate the top bone in the neck. Two, we can agree that this event would be rare because we don't see neck dislocations too often. Of course, it would have full body effects, and those effects are usually paralysis from the vertebra cutting the nerve, right? Because when we see a dislocation, the nerves are usually severed in the process, which is going to result in paralysis. And last but not least, the dislocation can be diagnosed by everyone. So we've got a completely dislocated neck bone, which is very severe, very rare, has full body paralysis effects, and can be diagnosed by everyone. Because if you walked up on a scene of an accident and you see a person lying on the ground, you want to help. So you reach out your hand, extend your hand out to them, and they're trying to grab it, but they can't. They can't move their arm at all. You know immediately that they broke their neck because everyone can diagnose that. Medical doctors, physical therapists, dentists, all of you, everyone can diagnose that because the event is so severe. Now, there's another event, another condition that can happen where the neck bones, if they can partially dislocate. Now, although this condition isn't severe at first, the partial dislocation will catch up to you over time and can cause a lot of future health problems. Now, partial dislocation, it's not going to be rare, but it's going to be extremely common because we see them all the time from the injuries throughout our lives. Now, it's not going to completely cut the nerve, but it's going to stretch and pinch the nerves, still affecting the entire body, but not to the extent of paralysis. And so when these nerves, when they're stretched or pinched, this is going to lead to less nerve transmission from the brain to the body, decreased function, so slower recovery. You may fatigue faster, leading to chronic fatigue. Your muscles won't activate at 100%, which could lead to chronic muscle imbalances, leading to chronic pain. The list goes on. But it's no fun to have a pinched nerve, right? They're very painful. You can feel the pinched nerve all the way into your fingers and toes sometimes. But here's the thing, because the effect is not paralysis, this partial dislocation goes undiagnosed. Well, except for a few. Now, those few are chiropractors. And just so you know, a synonym for partial dislocation is misalignment. And that's exactly what we focus on correcting as chiropractors.